here, and then we've got all the subscapular muscles and so forth, kind of influencing motion. So by tightening that down, it may actually alter what you're feeling. Okay. In some cases, though, if I had a table like this and didn't have a hole cut out, and I didn't know where the prone pillow was at that given point in time, I might still opt to do that, but just appreciate that that's going to alter slightly what's going on in regards to thoracic motion. Okay. So we're going to kind of go with him in this position as long as he can still breathe. I would normally not have a patient with their neck like this. I would roll up a towel even or whatever. But start where you want to go here. And then the idea is, and the one disadvantage of this is I can't get as close to him, So yeah, that's better. Slide a little closer for me. That's cool. Okay. So we're in this position. You're going to kind of basically pick the segment that you want. Find that segment. Use the area just distal to the pisiform. Place it right over that segment. That's the horse. This is the jockey. And again, I'm in this kind of straddle position where my one leg's in front of the other, and I'm putting pretty much all of my weight on the front leg, and then I'm kind of leaning onto the table. And I'm leaning right over the spot that I'm trying to mobilize. So I'm here like this, jockey on the horse. This hand is just the dummy hand, and this hand is doing all the mobilization. So I'm here, and I'm just basically providing that force, take up the slack, and then I'm kind of eliciting that force. So my left hand is what's providing that force. And I go to the next level, and I'm providing that force. All right, so we can go from level to level. Again, nothing different than what we did down here. Okay, so there are pavums for thoracic spine, pressure over the spinous. I could go, there's the spinous, I could go split finger on either side of the transverse and take my thenar eminence and do that if that's more comfortable for the patient. For mobilization, if I'm mobilizing this patient for treatment, I might do that because I'm going to do a lot of them and I'm going to push harder probably. But if I'm trying to assess, right there is a better way of doing it because then it allows me to just kind of perceive motion from that spot. Mackenzie, they do this, right? So this is on transverse, and they're pushing here, but now I've got two hands doing two different things. To assess motion here, I've got to make sure I'm exactly pushing with both at the same amount. That's really hard to do, I think. So, but it's really up to you as far as what you guys choose and what you might have become used to. That's thoracic pavum.